is also really low. Only 1/3 of people are guaranteed to get the stable food. And then, as you know, was in Gaza is really bad. It was held in 4 times in 2006, 2008, 9, and 2012, and latest one, 2014. And many incidents by Israeli actually happen daily basis, even not the war period. For example, at least 20 people will be shot by Israeli Air Force or the border control officer every month. And many people are also arrested by Israeli people daily basis. And then sometimes target killing also happen as a kind of assassination. And then shortage of electricity or clean water is also a problem, and they are suffering from these the daily needs as well. Now I little bit want to mention about the latest Gaza hostilities reality in 2014. Duration was 7th of July to 26th of August, 50 days, about 50 days. And our fatalities number is more than 2,200. It was the worst war in Gaza. And then the 70% of them are civilians, including more than 500 children. And then number of injuries are also massive. 11,000 people were injured, which includes the 3,000 disability cause of the 3,000 disabilities. And then after the war, even the 11,000 people still live in the shelter as internal displaced persons. And then rehabilitation cost will be $900 million US dollars. Then according the duration of rehabilitation is said will take the 15 to 12 years, which is really long. And no one knows, of course, another war happen might be in next 3 years. Default of payment of this rehabilitation cost also not enough. Only 50% was guaranteed by countries, according to the UNRWA Deputy Director, Scott Anderson. Then weapon use was also massive, 1,400 shots as an average per a day during the hostilities. As you can see, Israel launched total 66,000 shots to Gaza, and then compare that while Gaza launched only 6,000. You can see the huge gap or the huge military power balance difference between Israel and Gaza, how the Israel has massive power to kill every Gaza people. And then also UXO, unexploded ordnance, is problematic after the war. According to the specialist from UN agencies, UXO in Gaza remaining the 30% of whole the shells actually. So which means 7,200 UXO still in Gaza. Then as my understanding, at least 6 people were killed because of UXO after the latest hostilities. And then more than 70 people, civilians, were injured because of this UXO after the war. As you can see these pictures, the UXO is everywhere of Gaza. Then people doesn't know actually how it's difficult, dangerous. So children sometimes playing with these UXO. Actually, the 2 of these pictures was taken by the Ard El-Insan staff. Then not only UXOs, used weapons also problematic because those are contaminated by chemical things or some special metallic powders. Then after the war, when people clean up the town with levels, they also have to clean up those used weapons. Then those weapons, piece of the used weapons is everywhere of the Gaza. I took those pictures by myself, by the way. And this is a child from our target area. Because of used weapon, many people were proclaimed that the skin disease because of these used weapons. But no one knows why this kind of things happen and actually how these weapons are harmful for human bodies. And people doesn't know actually how much contaminated these weapons. This is also children's leg. Then damage to the medical sector also massive. As you can see, this is ambulance which was bombarded during the latest hostilities. And demolished clinics and hospitals during the latest war was 23, and then halfly demolished clinics and hospital was 62, and then 47 ambulance was completely destroyed by the bombardment. As you can see this picture, cannot believe actually. This is clear human violation, a human rights violation. Then some ambulance are carrying the the people who injured to the hospital, and then still they attacked this ambulance. Cannot believe it. This is a hospital, the Wafa hospital in Shujaiya. This hospital was caring about the disability people, and then provided some daycare services for the disability people, and then one doctor was killed in this place. Then I want to show some video how it's difficult in Gaza now, as general idea. The video of Beit Hanun, where is one of the Ard El-Insan staff live. This is Beit Hanun now, the north area of Gaza. Very close to our target area, by the way. Massive destruction everywhere of the Gaza now. And then to get rid of those levels is also difficult for the people. And last few months, finally, the step by step, the things going on. I could see the improvement just during last 3 months, actually. Okay, now I want to move to our project itself. Before the explanation of the project report, I want to show about some graph to describe some feature of the micronutrient deficiency in Palestine. This survey was done by UNICEF and the Ministry of Health in 2013. The right side of the graph is showing the average number of the iron deficiency in Gaza, boys and girls. Then actually more than 30% of children in Gaza are suffering from iron deficiency. Please keep it in your mind, while the West Bank is only showing less than 10%. Then this is our target area. More than 50% of children are suffering from iron deficiency, which is far higher than average of Gaza. This is a target area map. Birnaja is located in Jabalia, North Gaza. And the locational map, geographical relations like this. The JVC is located just in front of the Gaza port, and then Ard El-Insan, JVC's counterpart, is located in Nasser Street of Gaza City, and then Birnaja. From Ard El-Insan to Birnaja, it will take about 20 minutes by car. So staff members going to Birnaja every day by car and then walking. The main goal of the project is provide healthy environment for children and mothers through community mobilization approach in the target areas. Objectives of the project is to develop and lies capability of the community health activators. I will explain what is the community health activators later on. To enhance knowledge and practice of mothers and caretakers of children, And third, to improve nutritional health status of target children. Target group total about 6,000 in 2014, and then 30 community health activators, including 1,600 children and 4,500 mothers and caretakers. This is a detail of the target area. This is a map of Bir al-Naja. In 2013, as you can see, red area is conducted in 2013. In 2014, additionally, we did have the project this area, and then in future, in the next year, hopefully we want to do other part of Bir al-Naja, which described as green area. Then I want to explain the detail of the project structure itself. Through the partnership between JVC and Ard El-Insan, we train the beneficiaries. Number one, community health activators, 30 ladies from the community. What's the community health activators mean? They actually volunteer from the community. But we expect, I mean, the Ard El-Insan and JVC expect those ladies will get the enough knowledge through the project to be activators to expand the enough knowledge of the child health or nutrition inside of the community. Then accordingly, after we finish the project, those health activators can be kind of the voluntarily work, and then continuously this project is expected to work in future too. Then after the training of these volunteers, 30 volunteers, those ladies going to the individual household, as a home visit. And then also have the awareness session in the community. And then about 4,500 women and then caretaker will be trained or will get the counseling from those health workers in the home visit. And then accordingly, finally, the children, about 1,600 children under 5 years old will improve their health status. Of course, some of children are really severe case, so the Ard El-Insan will intervene to improve to take care about the severe case of children, because the Ard El-Insan has a clinic, and then there are the doctors in clinics as well. Then JVC is playing a role as a fundraiser and monitoring and evaluation, and sometimes send the specialist in terms of the child nutrition from Japan to give some special comment to Ard El-Insan staff. And then reporting to a Rotary Club is also the JVC's duty. This is the project pictures. This is the pictures of trainings. The left side is the lecture style of trainings to the activators, and then right side is on-the-job training held through the whole project period. Then Ard El-Insan staff will give some special training on the job training during the job training in the field actually. Then the ladies, the volunteer health activators will know step by step how do you conduct the child assessment or the awareness session in the community. Then the second activity is home visits, and then the left side is child assessment. Then right side is counseling to mothers, and the lady the most left side is actually community health activators. She's a volunteer, voluntarily working last 2 years for this project. She's really motivated. And an awareness session also held in public areas, including clinics, CVOs, mosques, and then kindergartens. Then this kind of sessions will be done by the community health activator under the supervision of the health supervisor of Ard El-Insan. Cooking demonstration is part of the awareness session. Then this is the most fun, entertained activity of this project actually. After the through the cooking, we can teach the healthy food to mothers with the reasonable resources. Then after the cooking demonstration, the giving the food to children, and we enjoyed all together, attendants will enjoy all together the meal we just make. The networking also important our activity. Actually, after we finish this project, we need kind of the station to accept the health activators instead of JVC or Ard El-Insan. So we maintain the relations with CVOs or kindergartens to attend these activities as a part of activity, the entity actually. Then the step-by-step through the networking visit, the teachers in the kindergarten or staff members in the CVOs will also be trained as a professional, and then at the end of the project, we expect to they became a kind of the station of the activators, and then after the project, the activators can come to this organization and in order to have the sessions instead of, the JVC provided the venue. If you really don't understand my point, please raise your hand and make a make a question. And then through these activities, we expect development of the social structure to prevent micronutrient deficiency of children in Belinaja. Then this is outcome of the activities in 2014 to 2015. Community health activators training was conducted, lecture style was conducted 2 weeks, 39 hours, and 90% of the community health activators are still working with our project. And child assessment were done for about 1,175 children, and then 64 children were really severe, so referred to the clinics of Ard El-Insan. Then home visits counseling were also conducted to 1,500 mothers and caretakers, and awareness session also were done more than 500 times. And 4,000 women and 1,200 children are attended to these awareness sessions. And a cooking demonstration also done many times, and then total number of networking visits to CVOs and clinics also done 29 times. Then this is the outcome. The community health activators themselves improved their knowledge from 69% to 91% during last year. And then in their practice level, they improved their practical skills, average 13.4%. The mothers and then caretakers improved their knowledge more than 70%. Then in practical level, also they improved themselves 40%. Then most important part, the child nutritional status also seen the many big improvement. The big improvement. For example, iron deficiency anemia got the 77% improvement last year. You can see the number of the children who is suffering from the iron deficiency is dramatically decreased from 613 to 474. And red line is saying the malnutrition, numbers of malnutrition. It's also decreased from 210 to 124. And the children of rickets also very few, relatively few, but still reduced from 35 to 31. So you can see how our project is effectively working even the last 1 year. Then another successful story also, the narrative-based success story reached to my ear every days. For example, this lady, the left side, right side, her name is Frial, and then she lost her sister, brother, and then father in 2012 hostilities, actually, in 1 year, only 1 year. And then she was suffering from sorrow, but since she attend this project, she could actually release her sorrow, she said. And she's really enjoyed this project. And this is also another community health activator. The left side, her name is Shifa. She's also energetic, very nice lady. She said, I am so motivated that I can play something important role in my community through the activities. She said that she's coming to the project site every day. Even the supervision of the Ard El-Insan is not available. She's currently working voluntarily, really, as alone. So this is a really good, successful story. And another lady is from Jabalia, Iman. She's one of the youngest community health activators. At the left side, left corner, she wants to become a nutritionist in future. And then she said, these activities are really giving me many practical experiences, she said. So accordingly, I think this activity is not giving only the child nutritional improvement, but also giving the opportunity as a job vocational training to the community health activators. And in future, maybe those ladies also can be a supervisor of the health nutritional the specialist in Gaza. We actually expected it. This lady is a beneficiary, Shaha, and then she is enjoying to attend this activity. She said, according to her, I'm feeling happy about I can check and control the health of my children by myself. And the booklet she has is the check sheets, which funded by global grants as well. And she is checking the health status of her children every day through these check sheets. And she is enjoying this activity. And then those two ladies also, the beneficiaries, founder at the right side said, cooking demonstration and awareness sessions are all important opportunities to obtain necessary information for my children. I'm happy to know new things, she said. This picture was taken two weeks ago. Then those children also from Birnaja. Luckily, the Birnaja was less affected by latest hostility. Only 3 casualties, relatively low. And then 3 houses are demolished by the airstrike, but really less affected, fortunately. Well, maybe some of you think that why we have to continuously stick on this project, because you can see the massive needs in Gaza now, including the infrastructure or the mental health care or the water shortage or electricity shortage. But the important thing is, what are they looking for? This is my kind of philosophy as well, why we have to continue this project. Because the project members in Gaza are looking for the continuous activity or commitment to this project. Then some of them are saying we are not animals in the farm, because the many international agencies or the UN agencies are giving many resources to Gaza, but they are just getting those things as free, but no activities or no commitments to these things. But the people want to do something by themselves. Then this project actually implemented by local people, by local needs. So even the budget amount is relatively really low compared with the big agencies, but still it's necessary, because this project can give them the kind of human dignity, I believe. So the not only materialistic support, but also mental support is necessary, I think, as the NGOs. As you know, the Palestinian situation is really hard anyway. Then solution is really far. Still 5,000 refugees are in all over the world. And then siege of the Gaza is really harsh, continuously. What we can do. So I believe that as NGOs, we have to do something to good thing. Then 3 points are main role of NGOs, which I think, including Rotary. For example, the huge gap exists between the massive support from the big agencies and the realities. For example, the white people in Gaza is suffering from the micronutrient. Calorie-based needs actually meet up to the necessary line. For example, the FAO or WHO or UNICEF or UNRWA provided enough food in terms of calorie, but still people are suffering from micronutrient because the quality of food is really bad. Then they cannot access to the vegetables or the vitamins, as you know. So we NGO have to fill in those gaps between the huge agencies and the small, the reality of the needs. Then also only NGOs can do the solidarity, make us solidarities amongst the civilians. For example, with Palestinian, with Jordanian, with internationals, and then even, I hope, even with Israel. For example, I'm in Jerusalem normally, and then I met many Israeli people, and they surely ask me, what are you doing here? And I always explain I'm working in Gaza to support children, and then I think what you are doing in Gaza is really crazy, and are you really sure? Do you feel really good to do this kind of things? And then the civilians in Israel also interested in, oh really, do you think so? Then they started to argue something with me. So, but if I am working in the UN agencies or the politician, I can maybe not say so easily, because I cannot show my political status in front of Israeli, have to be neutral, but I can do so because I'm working in the NGOs. So this kind of solidarity is also important. Then the big role is advocacy in order to change the structure itself. The political suggestions to each country. This is as a JVC though. I know the Rotarians cannot show the political status, but as a JVC, I want to do some the advocacy toward their own country. Then expand the ideas to others. This is also, I believe this is also important, my role. So this kind of things, the live as a